Afternoon, everyone. For you that are just joining, I am Jessica Quinn. I know my name says Far, but I recently got married, so it's Jessica Quinn. And I am a financial advisor here at SGL Wealth Management. Thank you for joining our series. We do this SGL educational series each month. And our goal to have these series is we just want to educate you, our clients, and make sure that you are making the right financial decisions. So with that, today we're going to talk about Social Security and Medicare, and we have two people joining us. So we have Laura Chastain and Chelsea Hogan, and they are with Chai Insurance. Well, first of all, they're a mother-daughter duo. I should not leave that out. And they specialize in senior products. So they do anything from health insurance to specialty insurance solutions. They work closely with people talking and navigating Medicare and Social Security. The one thing that we really like about them is they're known for their education first approach. So they really do try to do their homework and study and stay relevant with all things that are happening. And they have a real passion for helping their clients make good coverage decisions. So with that, I'm going to turn it over to you ladies to take it away.
Okay. Thank you for having us today. Chelsea and I have been in the insurance business for a very long time. We've been dealing with people who originally get Social Security and then transition into Medicare, usually at the same time. We're not Social Security experts. We're more Medicare experts, but we can tell you the basics and how Social Security and Medicare work together. So you want to
So we're CHI Insurance. We're an independent insurance agency. We are located in Cleveland, Georgia, as well as an office in Gainesville. Our Gainesville office is going to be on Thompson Bridge Road, in the Social Security office building. I am Chelsea Hogan. I have a degree in risk management and insurance from the University of Georgia, and I work closely with all my clients on Medicare and kind of going through everything and kind of how that corresponds with their retirement and their healthcare needs as they go through that process. And I'll let you do your introduction.
I'm a certified senior advisor. And I also am a insurance agent, independent insurance agent. I have helped seniors and retirees understand Medicare and their options for over 22 years. So we help them make a good informed decision. We usually go over all of their options as to how they like to cover those needs and help them make that decision. First thing we're going to talk about today is what is Social Security. Social Security can provide retirement income, disability income, survivor benefits, and spousal benefits. For many retirees, Social Security becomes the foundation of retirement income. It was really never designed to fully replace the working paycheck, though.
So also kind of how does Medicare cover the health insurance needs of that part? So there are two parts that you receive from Medicare themselves from CMS. And part A is going to cover your inpatient hospitalization, skilled nursing, hospice, and some home health care services there. That is typically at no cost to the Medicare beneficiary as long as they've worked their 40 quarters or 10 years and paid into Social Security. Part B, we also get directly from Medicare. That's going to cover the doctors themselves, outpatient care, preventative services, lab work, durable medical equipment. There is a charge for Part B. Standardly, that is going to be $202.90 per month in 2026. We're going to touch on it in just a little bit, but that number can be different based on income. That is all that we receive from the federal government as Part A and B. The main thing that you don't see covered in Part A and B is going to be an annual maximum out of pocket, as well as no prescription coverage. So those copays and percentages that you have that are built into Part A and B that you would be responsible for as the Medicare beneficiary never stop generating, meaning no maximum out of pocket. So that's where it becomes very important that we add something in addition to Medicare. In addition to Medicare, you have the option for Part C or Medicare Advantage plans. Those are private alternatives to original Medicare. They usually include what we call sometimes the goodies, dental, vision, hearing benefits, all of that good stuff. And sometimes they may also include prescription drug coverage built into that policy. That kind of replaces original Medicare, but it provides you with all of the benefits that original Medicare does, plus the additional services and benefits that that individual insurance carrier decides to build within their plan. Part D is going to be your prescription drug coverage. As I said, that can sometimes be built into Part C, or you can have a standalone Part D. Sometimes there's premiums for that on top of the 202.90 for those products. It just depends on what products meet your needs as the Medicare beneficiary when it comes to prescriptions, as well as doctors and hospitals and things like that. Now, if you decide that the Medicare Advantage Part C is not the option for you, there is also the option to add a Medicare supplement with that standalone Part D. You still have original Medicare with that, Parts A and B, and then the supplement works in conjunction with that. You pick your private insurance carrier, and then the policy pays in addition to it. So it coordinates benefits with Medicare A and B, and then your supplement. Sometimes those are also known as Medigap policies. So you kind of have two options when you are considering plans to add in addition to Medicare. Medicare supplement or Medigap with a standalone Part D, or Part C with a Medicare Advantage plan. And those plans would be private insurance alternatives to original Medicare that include drug, dental, vision, hearing, all built into one policy. And there's pros and cons to both of those options. So that's something that we help all of our clients distinguish what is the best or what is the most cost-effective fit for you as the consumer based on your personal healthcare needs and also your budget.
You want to talk about Irma?
Yeah. So IRMA, this is where we were talking about the cost for Part B. IRMA stands for Income Related Monthly Adjustment Amount. IRMA is a surcharge on top of the $202.90 per month. The IRMA is generated by the federal government. The IRS basically looks at your tax returns from 2 years prior to decide if that applies to you. And basically, when you are a higher income earner, you will pay more for your Part B. Now, that is, like I said, decided on by the federal government, and Social Security will notify you directly if that applies to you. Now, if you have had some type of life event that had made your income look higher, or your income was higher, such as retirement, divorce, death of a spouse, things of that nature, you can request an appeal of that, and that can be reconsidered. But all of that is done directly through Social Security and determined that way.
So, how is Social Security calculated? Generally, it is based on your highest 35 years of earnings, not your last 3 years. So, if you've worked fewer than 35 years, zeros are included. What that means is they'll still take a 35-year formula, and any missing years count as zero. They put zero in for those years, which may actually reduce your monthly benefit amount. Continuing to work later in life sometimes increases those benefits by replacing lower income years or the zero income years. So a lot of people choose to do that later on to have a few years of work credits that are higher so that your monthly benefit can be higher. Claiming early also permanently reduces those benefits, um, while delaying benefits can increase your monthly income. Full retirement age. This is for many retirement. Full retirement age is between 66 and 67 as of today. If you start your benefits as you can start them as early as age 62, and you can delay those benefits all the way up to age 70. Um, if you are a widow or widowers, may be eligible to begin getting your survivor Social Security benefits as early as age 60. The longer you wait, the larger your monthly benefit. A lot of things that are common Social Security mistakes. Claiming too early can sometimes, of course, affect your monthly benefits that you receive. Not realizing that you can still work while receiving benefits. Ignoring spousal or survivor benefits. A lot of times that is very much missed. If you do not ask about that with Social Security, they don't really volunteer that information. So make sure that you get all you are entitled to by asking that question: which one is higher if I take my benefits or my spousal or survivor benefits? Those are two different things. And the other common mistake is assuming Social Security will fully fund your retirement. It will not. We have all found that out. Many retirees are still need their savings, investments, proper Medicare planning, which we are here to help you with to prepare for your health care and your retirement costs going forward. It's never too early to ask those questions.
Okay, so Social Security enrollment timing. So, as Laura just explained, Social Security enrollment can vary based on your situation and what makes the most sense for you. Medicare does not have to coordinate with your Social Security on there, which is great. So, you can opt into Medicare at 65 and not take your Social Security. That is something a lot of people do not understand, and we hear that all the time. Well, I can't have my Medicare because I'm not taking my Social Security. That is not the case. Medicare enrollment is a 7-month window, so 3 months before your 65th birthday, the month of your birthday, and 3 months after. Now, if you are receiving Social Security benefits at 65, that 202.90 monthly premium is going to come right out of your Social Security check. But if you are waiting for Social Security and you want to take Medicare, that Part B premium can be paid directly to Social Security, and that can be set up directly through the Social Security website as a monthly EFT out of your checking account, or you can be billed for that. But if you are billed for that, note that it's going to be billed quarterly.
Yep.
If your if something crazy happens and you miss that payment, they will cancel your Part B enrollment, and that becomes a really big headache and can endure some penalties and different things and limits on when you can get it back and things. So it's very important to understand how that Part B mechanism is paid, especially if you're not drawing the Social Security yet. Also, if you are still actively working at 65, that is happening more and more and is very common. You don't have to take your Part B. Your Part A is automatically going to be enrolled. You are receiving that because you have paid in your 40 quarters, you've worked, you've paid for that. Part B for the 202.90, you can delay that enrollment as long as your employer is offering you credible coverage. And we'll talk about kind of what that means in different situations of credible coverage based on what your employer is offering in just a little bit.
Okay, so some real life scenarios. So let's say a client claims Social Security at age 62 after a layoff and later realizes that their monthly income is permanently reduced. So that is one scenario. Another client enrolls in Medicare Part B at age 65 while still actively working and paying for employer coverage at the same time. That results in unnecessary premiums. There is no need to take Part B if you are staying on your employer coverage. That is just extra money that you do not need to spend. You can take your Part A and then get Part B later on. One thing to know about taking Part B later: if you are retiring and you're going to COBRA, do not delay Part B at that point, because COBRA is not credible coverage for Part B. So as long as you're staying on the active employer coverage, then you're good to go. But if you move to COBRA, you must take Part B. It is not credible. Also, a divorced individual later discovers that they qualify for spousal benefits based on a former spouse's work record after a marriage lasting more than 10 years. So if you have not remarried and your um, former spouse you were married to them for 10 years, you may qualify for their spousal benefits, which may be higher than ours. So that is always something to look at as well.
One other thing I want to bring up about credible coverage as you're still working, regardless if the policy is COBRA or employer sponsored, if it is a high deductible health plan, really need to check into all of the fine print of that. Those plans are also not credible coverage for Part B and Part D. So that is something a lot of people miss. I have a client right now who is now paying a penalty for the rest of her life because she did not realize that the high deductible health plan was not credible coverage. And it's costing her, it's not a crazy penalty, but that's her money she's having to spend and was not aware of that. Also need to check into those HSA contributions and things of that nature, because those do have to stop and stop earlier than you might think. So make sure that you are reviewing that, not just before you are turning 65, but the year that you are turning 65 at your open enrollment with your employer, because it may make sense not to take that high deductible health plan
That last time.
that last year or at 64 as you're turning 65 into that health plan through your employer.
Yeah, you need to stop contributing to the HSA 6 months in advance. Okay. Mythbusters. This happens all the time. Most experts believe that Social Security will simply they do not believe that it will simply disappear, although we do expect probably some future adjustments. And the other one is, do divorced people really qualify for spousal benefits? We touched on this a little earlier, but yes, in many situations, if the marriage lasted at least 10 years, and the other requirements have been met, then yes, they can still qualify for spousal benefits. So go ahead.
No, just wanted to say that this information is just for general education purposes, and everybody's individual Social Security and Medicare situation is different. We are not Social Security employees and do not work for Social Security. So all of that just needs to be confirmed with Social Security, and these wonderful ladies here will be able to talk to you more about your finances and IRMA and all of that good stuff and how that works for you. But if you do have any questions relating to anything, of course, we are always here to answer.
Perfect. Thank you, ladies, so much. This was very informative. I am going to take a minute since we have a few minutes left, if it's okay with you, just to open it up for questions. So if
Of
anyone
course.
is perfect, if anyone's on the phone line and you have a question, you can unmute your line now, or you can type it in the chat queue. And while we're waiting on questions, I have one personal question. So as you were talking, I just want to know, you were talking about Irma and the appeal process. How long do they have? Do you know before, like, how long does the appeal process, like, is it a certain period of time that they can appeal, or how does that work? And if you
There
don't know,
is a
that's okay.
Yeah, I don't know the exact number of months or if it's a year or longer. But you should get on it very quickly. There's a specific form with Social Security to fill out that you have to send in to appeal that.
That makes sense. Yeah. Thank you
Mhm.
so much.
Mhm.
Do we have any questions? Anybody want to ask a question from the audience?
Yeah, I have a question about Irma. Is there a ceiling? How high can it go if you were a high income person?
Yeah, let me get that exact number for you. Oh, bear with me. Yep. Let me. Do you have your thing?
Right here. I think it's around $700 a month.
Okay.
I've got the exact amount here. Hold on.
That's a great question. And the other thing that I learned while you guys are looking that up is I did not realize that you had to stop the HSA
Mhm.
6 months before.
Six
That was,
months before.
yeah,
Yes.
that's incredible.
So Irma is going to be an additional $487. So the 202.90 plus the 487. And Irma also applies to your Part D premium, meaning more an additional cost to drugs of $91. So that final Irma total at the ceiling is going to be 780.90.
Wow.
Um,
Yeah,
but
that includes the 202.90.
mhm. Now that all is varied based on where your 2-year tax return looks back. That is at the top of the amount. So let me get you that exact number. If you are a single individual filing taxes, that is greater than 500,000 for 2 years look back. And if you are married filing jointly, that's 750,000 or more. So different levels based on where those tax returns fall.
And it goes down from there. What's the first rate up?
A single individual is 109, and then a married filing jointly is 218.
That would be your first rate up.
Okay.
So what happens after the 2 years? Does it automatically reduce?
It
If
does. It automatically resets. If
okay.
you fall whatever threshold you fall back to, it automatically resets. You don't have to contact them or anything. It will automatically do that.
And that's done because the IRS and Social Security Administration talk to each other?
That's correct.
Yes, or theoretically.
Okay.
It happens that way. I've had that happen
Which
before.
is good. And that's a good
Yes.
thing that they're keeping a pulse on it. Yeah.
Yes.
Yes.
Yeah. Thank you for
Thank you.
that question, Ken. Is there anyone else that I see? Angel, your line is open. Do you have a question? No, maybe not. I just see she's unmuted, so I was curious. Well, with that, ladies, thank you so much. I think this was super helpful. I'm sure we'll get questions. Maybe people just don't want to ask them on here, but if they come to us, we'll
Sure.
be sure to send those your way to get your expert opinion. And thank you again for partnering with us for this
Actually,
session. We really
I
do
have
appreciate. Oh, sorry.
one more quick one.
Sure.
What do if I'm looking for Medicare supplemental coverage? How do I go about that? Do I call you and you is that what you do?
Yes.
Yes, that is exactly what we do. We will review all the different carriers that are out there, all of the different supplements that are out there. So whether you're looking at G, N, whatever makes the most sense for you, we will review all that. We will explain to you how that works for the Medicare supplement, as well as do a comparison to see if Medicare Advantage makes sense for you. So we'll throw everything out there on the table and let you make the decision of what fits your needs the most cost-effective way for your health care needs needs at the doctor as well as your monthly budget.
Wonderful. Thank you.
Mhm.
Perfect.
So tell them how they can reach us.
Yeah, so you can reach us directly at the office at 706-609-9811, or also at online at the chiagency.com. Or just come by and see us as well.
And they're located conveniently right next to the Social Security Administration.
We are
So if
right
you
on the
guys,
first floor.
yes, if you guys,
They're on the second floor and we're on the first.
yeah. So if you're in that area and you have questions, just pop down and see them. And if you have any questions and you don't have their information, reach out to us. We will get you in touch with them and they will do the same for us. If, you know, if you guys have
Exactly.
clients that need
Yes,
help
I
trying
do.
to navigate what's best for them from a financial standpoint, we're happy to help them. So
course.
thank you again, Chelsea and Laura. I really appreciate your time.
We
Thank
appreciate
you.
the opportunity to speak with everyone.
Take care, everyone.